everybody. This is Dr. Anthony Cave, your physician anesthesiologist and integrative medicine specialist. Today, let's talk about olive oil and whether it can help us against COVID-19. We've all heard that olive oil is good for you, but what does it actually mean? Medically, how is any food good for you, and right now in particular, can olive oil help us against COVID-19? Let's do a high-yield review of new research on olive oil, and at the end, we'll share the safest strategies for buying olive oil at the store and cooking with it. To answer the big question about olive oil during our COVID-19 crisis, let's start with exciting new results from the first study in the United States to research the effects of olive oil on heart and brain disease. Remember, these are the risk factors that can influence COVID-19 infection severity. First, why do we bother to study olive oil's health benefits in the United States? Our strongest evidence supporting olive oil's health benefits come from European studies on the Mediterranean diet that really showcases extra virgin olive oil. In fact, that protocol encouraged at least 4 tablespoons of olive oil per day. What's 4 tablespoons of olive oil in context? Average olive oil consumption in the United States is less than half a tablespoon per day. In Spanish Mediterranean populations, average consumption is nearly 3 tablespoons a day. So what were the results of the Mediterranean diet? A 30% reduction in major cardiovascular disease. Remember, cardiovascular disease is the #1 cause of death across the world, so that should catch our attention. In the United States, olive oil isn't nearly as commonly used as in Mediterranean regions. We rely more heavily on saturated animal fats and other plant-based oils. So it was impressive to see a homegrown, United States-based study showing the benefits of olive oil stateside, too. Indeed, starting at just half a tablespoon of olive oil a day, there were associations with reductions in coronary heart disease. That's exactly the population the COVID-19 infections hit very hard. But hold on, here's where we need to be careful. Like I said earlier, it's very difficult for a food to be healthy for you. This is an overly simplified view. It's not what foods are healthy for you, but what foods are healthier than other foods for you. And no, it's not just semantics, it's very practical. While extra virgin olive oil has such nutritional value, it comes packaged in lots of calories. 1 tablespoon of olive oil has 120 calories, and however nutritious those calories are, their effects can't be ignored. By no means are calories inherently bad, but their effects in the body depends on the context of other foods being eaten and the hormonal state of the body. This is an important discussion, but one that we'll have to save for a future video. The take-home point is that instead of looking at olive oil as healthy for you, let's look at olive oil as healthier for you than other foods. In particular, olive oil is healthier for you than other fats and oils. So how much healthier is olive oil than other fats? Our same study looked at the effects of replacing margarine, butter, mayonnaise, and dairy fat with olive oil. What did they find? Similar reductions in cardiovascular disease. This is the take-home point. We don't want to necessarily drown ourselves in olive oil because it's very easy to overdo the calories and feel unwell. Rather, we want to replace our other high-calorie oils and fats with a healthier option, olive oil. These are the techniques we want to focus on, easy tricks that can improve our health today and in the long run. Now let's go back to COVID-19. How is olive oil relevant to infection from coronavirus? In past videos, we've talked about the risk factors for severe COVID-19 infection. Hypertension, diabetes, and obesity are associated with landing in the hospital from COVID-19. And landing in the hospital has a 20% chance of death. Despite our best prevention efforts, the world's best hand washing, mask wearing, and distancing can never reduce our exposure risk to 0%. That's where risk reduction comes in. We need to focus on things that can not only reduce our chance of exposure to coronavirus, but also from developing severe disease from coronavirus. We don't want to end up in the hospital. Hypertension, diabetes, and obesity are all risk factors for severe COVID-19 infection. And olive oil is an easy strategy that can likely help us reduce the progression of those risk factors. And a bonus, they give us lifelong benefits against the #1 cause of death, cardiovascular disease. So how can we safely and tastefully integrate olive oil into our diets? What are the different types of olive oil, and should we care about refined versus extra virgin? To maximize the health benefits of olive oil, we should learn the right products to buy and how to cook with them safely. After all, we want the best taste as well as the nutritional value from our food. Spoiled olive oil doesn't taste good, nor does it have the same health benefits. The take-home is simple. Use small, dark bottles of extra virgin olive oil and avoid high temperatures on the stove. That's all there is to it. Why? Firstly, we're interested in the olive oil with the highest concentration of polyphenols, the compounds we believe confer the health benefits of olive oil. This is extra virgin olive oil, the first press of oil from the olive. As a plus, it also has the most vibrant taste. This is in contrast to virgin olive oil, which generally has a lower concentration of polyphenols, and refined olive oil with the lowest. Cold pressing now refers to how the oil is extracted. While most modern extraction methods no longer use heat, it's important to recognize because heat causes oil to spoil and turn rancid. Rancid oils lose their taste and nutritional value. This is why we want to shield our oils from heat and light so they'll last longer for us. That's also why buying small bottles is preferred because they're less likely to go rancid before you use them up. For this reason, if you want to store your olive oil in the refrigerator, feel free. It will get cloudy and thicken, but it won't harm the oil. Secondly, about cooking temperature. When you heat olive oil, it begins to form smoke around 350 to 450 degrees Fahrenheit, depending on how refined the oil is. Why do we care about this smoking point? Because the oil will begin to taste bitter, and the nutritional value will further degrade. In fact, oil heated to those temperatures can be harmful to consume because it can cause further oxidation in the body. Extra virgin olive oil has the lowest smoke point of around 350 degrees Fahrenheit, and refined or regular olive oil has the highest smoke point of around 450 degrees Fahrenheit. Virgin olive oil falls somewhere in between. For reference, a stovetop can easily exceed 450 degrees, especially if you're frying food. So the take-home is that olive oil is safest when eaten raw, such as over a salad or mixed with prepared food, and you should be careful as the temperature increases with baking and other cooking. You should never roast or grill with olive oil for these reasons. Lastly, about fake oil scandals. It is true that some olive oils are illegally mixed with cheaper oils. Fortunately, it appears rare, accounting for less than 5% of oils. You'll hear people recommending tasting and smelling the oil to tell if it's real. These are incredibly subjective tests. If you want to increase your confidence, simply use third-party chemical testing to verify that you're purchasing true extra virgin olive oil. I hope you found this information helpful and practical. Remember that there is so much we can do through our daily lifestyles to stay safe against COVID-19 and in the long run. As always, subscribe to stay updated with the latest information, leave comments below, and stay safe out there.